Our hospital is a pediatric hospital. Our patient, Sela, will go into the emergency room, where she will find a tablet waiting for her to fill out her symptoms. The survey will ask her these questions. The information will then be sent to a specialized nurse that will look over the answers to the survey. She will then determine the severity of the patient's condition and direct them to the most appropriate branch of the hospital. This innovation will help with long wait times for pediatric patients and the limited access to specialty services, because it will narrow down the best suited doctor for each of the patients, therefore preventing the long wait times for seeing a single general doctor.
In order to reduce congested hallways, our emergency room is designed to have wide hallways for nurses and doctor use only. The purpose of this innovation was creating wide hallways for doctors and nurses so that they are able to go in and out without restricting or distracting patients.
After Sela's survey results were analyzed, it was suggested that she went to see the psychiatrist right away because she complained of visual and auditory hallucinations and difficulty concentrating. She is then directed to the elevator.
Many hospitals have limited access and long wait times for specialty services such as psychiatry, orthopedics, oncology, or surgery. A room is on the second floor meant specifically for those patients. Our staffing includes a pediatrician, psychiatrist, and a gynecologist, which all have their own section to care for patients. Our innovation is our second floor, which aims to reduce traffic and long wait times while providing sufficient access to those who come in for specialty services, by providing a specific section that is around the clock, staffed by multiple specialties, and prepared for a patient's situation.
After Celia is seen by the psychiatrist, the doctor sends for blood work and an MRI for her. Our hospital reduces the long wait times for lab work and imaging results by having a room that has multiple computers and machines working at all times. We have many experienced volunteers and interns constantly checking the machines to ensure efficiency. Our innovation for this part of the hospital is a machine that can process lab work and images at the same time. After the psychiatrist looks at the blood results and the MRI, he prescribes Sela some medication that she can conveniently pick up at our pharmacy. And that concludes Sela's visit to the hospital. However, there are other situations that she did not encounter.
Prepping and cleaning rooms for the next patient seems to be a huge issue in today's emergency rooms. We have cleaning supplies and sterilizing equipment that is top-notch and helps eliminate bacteria in a matter of seconds. Our staff contains of 2 volunteers who change bed sheets every time a patient comes and goes. Volunteers prep rooms and are trained by top-quality staff that prepare them and help them use their time as efficiently and quickly as possible. Our innovation, we have created a solution for speeding up the process of prepping rooms by creating a top-notch sterilizer that removes bacteria from room in a matter of seconds. It is a common issue to see inadequate nursing/physician coverage for all patients. In our hospital, there is always staff prepared and never understaffed areas in our hospital. Each section has 3 to 4 nurses on hand taking care of patients, both emergent and non-emergent. We have a larger staff with part-time and full-time positions. Staff with full-time positions should each have alternating shifts with other full-time nurses and physicians. Part-time physicians and nurses' main area of focus should be treating patients who present with urgent and non-urgent symptoms. That way the hospital is never left understaffed and the employees are never extensively overworked. For our innovation, nursing and physicians should be assigned an appropriate amount of patients based on the severity of the patient's condition. If a patient presents and seems to be more emergent than the other, it is crucial that there is always a staff member that is more on hands with the urgent one and a part-time staff member also keeping and running labs on what presents to be a less emergent patient. Slowdown in care when trauma arrives is a common issue in ERs. In our hospital, the ambulance entrance is connected to the triage so it won't disturb the waiting room. For our staffing, we have 3 to 4 nurses prepared to check their vitals and check how much they need help. It is important to keep things moving, which is why our hospital is built to keep the flow of incoming patients and trauma running smoothly. As trauma arrives, it is common to see slowdown in care. However, our hospital aims to reduce this by creating an all-hands-on-deck approach in each area of the hospital. Each area is fit to treat patients accordingly to their symptoms and severity. We are never understaffed and are always prepared and ready to handle all situations.
Wait time for pediatric patients who become upset and uneasy. Physical. The flow of the hospital is managed by the different areas of medicine and different classification of severity between patients. Each area, like the waiting room, is run by providing care to all patients no matter the urgency. Staffing. The abundance of specialists in the second floor will decrease the wait time for pediatric patients. Innovation. The survey results increase the speed of assigning patients to a specific doctor. Limited ability to track patients as they move within the hospital. A. Physical. A bracelet put on by an intern after filling out a survey. B. Staffing. The nurses would be tracking the patient through the bracelets on the computer. C. Innovation. Colored ER bracelets based on how sick they are. Red is for emergent, orange is for urgent, purple is for non-urgent.
Our hospital is built large enough and has wide halls that allow heavy and bulky equipment to move from room to room without restricting patient movement and becoming tedious. The staff is trained to be able to handle heavy equipment safely and quickly. They've learned to use our innovation that facilitates the movement of equipment through automatic machines with wheels that move around the hospital on their own. Thank you for your time, and we hope you consider visiting our pediatric hospital.